Little Big Town and Tornado on 95.7 WCRC. Joining me now, Dr. Ryan Jennings. Ryan, can you hear me okay?
I can. Good morning, Gail. How are you?
I'm doing just fine. How are you doing? How are things at the hospital?
You know, we're good. We're working a lot of hours, but that's all right. That's what we're here for, and we're well, I don't want to say we're looking forward to anything about it because we sure aren't. We sure hope that all the great work that's being done in the community and our families are doing to make sure that they're staying home makes it so we did a whole bunch of work and then everybody just rolls through this and is back to some sense of normalcy over the next few weeks.
Exactly. Hopefully we can look back on this and say, all our preparations were for nearly nothing. That's the hope and the prayer right now.
It sure is. It sure is. But I did want to just have a couple minutes of your time this morning to kind of talk about probably the thing that I'm hearing the most about, at least from folks with concern, and that's the questions around testing. And you know, you've seen you've seen a lot of conversation around it on national media, and you've seen things in communities where they're doing drive-through testing and those types of things, and you know that raises a lot of questions from folks about, and we get a lot of phone calls from folks saying, you know, can I come and get a test? And you know, we've continued to work with the CDC and the Illinois Department of Public Health around appropriate utilization of testing. And you know what changed and why things are a little bit different is the fact that in Illinois, once they've identified that there is presence in the community, testing people that aren't necessarily sick, you know, necessarily needing hospitalization, doesn't really change anything. It just tells us that there's one more person out there with it, but it doesn't change what we can do. And so we've continued to focus our testing only on those recommended by the Illinois Department of Public Health with those that are requiring hospitalization, because if you're sick enough that you need to come into the hospital, it potentially changes what we need to do in the hospital as far as how we isolate appropriately, what type of protection that we wear, and it gives us a little bit of information for doctors and providers to be able to talk to families kind of about what to expect.
Right.
But if you're able to go home and kind of, you know, ride this thing out at home, having a positive or negative doesn't provide a lot of information, because we should all be practicing, you know, social distancing. We should all be kind of self-quarantining when we're sick and staying away from, you know, friends, family, etc. So if you're not coming to the hospital, the positive or the negative is not terribly important. The only other exception out there is that when your home is a facility that is what we call a congregate living environment, meaning you're going back to a nursing home or a assisted living, a dormitory, a correctional facility, those types of things, where returning you back to that environment because of the inability to essentially self-quarantine, you know, you would potentially spread it to a multitude of other people. So that's really the two areas where we're focusing the limited resources that we have around testing supplies to make sure that we identify those where it's going to have an impact on what we're doing. Most of the drive-through facilities and those types of things are being operated by commercial labs and not really under the direction of the Illinois, you know, or any public health department for that matter. And I just clinically as a physician, I don't know that it adds anything. It doesn't change what I'm going to do. If you're able to go home, you need to be taking care of yourself at home.
Exactly, and just weather it and follow the guidelines and follow the doctor's order. You know, take the Tylenol, stay hydrated, and just have to tough it out. You know, that's just all there is to it.
That's right. And you know, we're continuing to kind of evolve our strategy. I think at this point, hopefully you've seen some of the kind of final ideas around how we're going to work with our visitors and allowing support people in kind of one at a time into the designated areas that we have, so that we limit the exposure of those visitors to, you know, the building itself, because there is the problem of having asymptomatic people potentially potentially spreading the virus, and at the same time, vice versa, protecting our healthcare workers and our fragile patients that are here with, something other than that right now, thankfully, but reducing the possibility of somebody coming into the building. And so the visitor restrictions are really painful for folks, and so we have now got some processes where we've got some additional iPads and iPhones and those types of things, so folks can FaceTime with loved ones while they're kind of enduring this period of separation. And I just appreciate everybody's patience as we, discern ways to continue to be as protective of both the community and those that have entrusted us with their care.
Right, because, we're talking about, the restricted guidelines now as far as visitation goes, and they make so much sense, Ryan. I think that y'all have done a fantastic job on that. We talked about that last week. And there's also the possibility of people coming in that are asymptomatic with other things, and they're, could possibly be exposing their family members that have COVID-19 to something else, which is not exactly what they need right now.
No, you're very correct, and so as painful as they are, I really think at this time they are a necessity, and we're checking those folks. We're making sure that even if they're asymptomatic, as far as they know, everyone entering the building, visitors as well as our employees, our physicians, our other providers, et cetera, are all screened for fever, because sometimes you don't realize it, and so we want to make sure that we identify those folks and then not allow them to enter the building and provide them with care if they need it, or hopefully just the ability to go home and recover from a viral illness.
Right. The one question that I've had people actually ask me this, and it's the only question that has come up, and I actually haven't had time to research it. I don't necessarily believe what I read on the interweb, so I would rather hear it from someone like you. What is the approximate incubation period in this once you've been exposed? Do we even know yet what the incubation period, is it 7 days?
So what they've said is 14 days basically is the potential kind of long end of the incubation period, with the idea that by 14 days, if you're not symptomatic, it would be extremely unlikely that that you have symptoms, or that you're carrying it. But what we have seen clinically is most folks become symptomatic around day 4, day 5 after an exposure. The tricky thing that I think becomes relevant, especially now, is just it's harder to know when you were exposed, because even though I maybe that was around somebody coughing day 1, if I go to Walmart day 5 and I run across somebody that's really asymptomatic, it's just so hard to trace back to that source at this point, which is why the idea of regardless of your symptoms, regardless of the symptoms of others, practicing social distancing, good hand washing, those things that we keep focusing on are really what's going to stop the spread of the virus. It's really about getting away from each other as humans, which is not natural for us at all.
It isn't, no.
And extremely tough. We need to be extra attentive to reaching out via telephone, via FaceTime, those modalities to especially the elderly that definitely have no business, no need, if it can be avoided, to be coming out into the community. So helping them to get the groceries, get those things to them without having them out in the community.
Right. Well, I guess that's probably where I've been hearing, like if you think you've been exposed to self-quarantine for 7 days, and, if you show up with no symptoms, another 7 days would be better. But, this is what I was hearing conflicting reports on. But now it makes sense with what you've said about many times you will become symptomatic within 4 or 5 days after you've been exposed. So that's probably where the 7-day thing is coming from. I
think you're right. And I just think we're learning a lot as this thing goes on. And every time we think we've got, here's the way we're going to handle situation XYZ, then, some new information comes in. And so we have to continuously evolve to make sure that we're kind of on top of the latest and greatest. But the overall plans that we kind of talked about last time, as far as the ability to triage people through the tent and the in front of the emergency department, the tent in the front parking lot to potentially use as overflow, both of those remain closed, but again ready to manage that. Tremendous outpouring of support from the community with donations of protective equipment, eye goggles, face masks. I didn't realize, just my own ignorance, just how many businesses use these N95 masks. I mean, everybody that sprays paint, everybody that does a variety of tasks. Agriculture uses a ton of these N95s to protect themselves, and they've been extremely generous at coming and giving us additional supplies, cleaning supplies. We've had several businesses donate those types of wipes and things to clean our surfaces, because that's part of it, is trying to maintain safety of the contact surfaces within the patient rooms, of course, but also the enormous public areas. As we're again, even though we're limiting visitors, we have to be attentive to our surfaces, just like you should be in your homes, and you should be as you're going out in the community around, trying to minimize contact with those surfaces, not touching your face, those basics around trying to stop a virus in its tracks.
Right. All good advice. And I like the idea of just saying, 14 days, period. Don't push that 7-day thing. Go for the 14 days if you think that you may have been exposed, and stay inside away from everybody else for 14 days. That's just probably the smartest thing to do at this point.
Well, for both sides.
Yes, exactly.
Both, if you have it, you're not spreading it, and honestly, if you're away from everybody, hopefully, then you don't get it either.
Right,
so
exactly.
It's good for both sides.
Exactly. Well, Ryan, we appreciate you taking your time so much to talk to us, and hopefully you'll have time to talk to us later, or maybe Friday. I don't know, tomorrow, whenever you have time, you call.
I so appreciate that.
That's
and
fine.
I wanted to catch you yesterday, and I told you I just can't figure out how to be in two places at once, but I'm working on it.
Well, I told you I want that recipe whenever you figure it out, and so do a lot of other moms.
Absolutely.
Okay.
Well, Gail, thank you, and thank you to WCRC for letting us come on.
Anytime, Ryan, anytime. Y'all take care over there, and thank you all for everything that you're doing.
Bye-bye.
Bye-bye.